Public Health 1.0 and 2.0 started a long time ago, where it was really protective in nature. It was making sure we had clean water and that we had access to vaccines, and it was ensuring that people were protected at the most basic level.
We've moved now to 3.0. Now they build upon each other. We're still doing food safety inspections. We're making sure the water's clean, as well as we're even down to the babies and mommies levels, where we have nurses that do home visits for first-time parents. But now we're looking at how do we become health strategists.
Public Health 3.0 isn't just about responding to crises, it's about anticipating challenges, anticipating health burdens, and being preventative in our approach.
People do see public health at times that they're the enforcers, they're the health inspectors, they're the ones that made you wear a mask during the pandemic. We are some of that, but there's a lot more to what we do in public health. Our role is to look at the entire population of Larimer County and look at where are there, first and foremost, inequities in achieving optimal health outcomes.
I think we have seen these partnerships and some of that light that's been shown on public health, as these are some areas that are showing some disparities and some needs that we have a lot more opportunity to work together to make an impact, and that it's not just public health doing that as an entity, it's public health as a system.
We know that youth mental health is a real challenge in our community, and we really need to step up for our youth and make resources available to them so that they can take charge of their mental health.
I realized how severe the mental health crisis was among teens in Larimer County, and as a teen myself was kind of looking around and saying that I didn't really see too many spaces where I really felt like I could go and totally feel comfortable and belong. TAC212 is what we refer to as a third space, which is somewhere away from school or home that's free and just as easy to get to, where they can relax and connect to their community.
This project is a long time coming, and the enthusiasm for young people to finally have this place is just through the roof, and it's really, really exciting to see this project come to fruition.
A place like this to where there's no expectations, you don't have to share what's hurting you, you don't have to feel trapped, you don't have to feel afraid. It's somewhere you can really just be to feel comfortable and okay.
TAC212 based most of our programming on what teens have asked for. From furniture to what we're going to eat here, they made all the decisions.
I think that the best way to solve teens' problems is to get teens' input.
I think the value add to incorporating youth voice is innovation. I think that the more innovative we can be and the more forward thinking we can create a truly inclusive environment and a truly inclusive community.
For teens struggling with mental health issues, I think we provide an open space with different activities that will engage them. It allows them to find different parts of themselves that maybe they haven't searched for or found yet. Introduce them to hobbies that can get them going and introduce that dopamine and that serotonin.
I think the most rewarding part of my job is empowering young people and elevating and amplifying their voice and allowing them to execute the vision they see.
Partnerships are really critical in this piece, and our ability to tell our public health story and to explain our role in that. Again, we don't do this independently.
We know that we can't do this alone, that it is an issue that involves many partners in this community. I think the big win for kids is systematically that PSD, CSU, city, county, we will begin to start changing how systems deliver services to kids.
We're taking a holistic look at the data, trying to assess what are the most important aspects of it, and then communicating it to folks in a way that connects to their real lives. And of course, one of the resources we're able to offer our partners is our health and well-being dashboard, which provides data across a number of different themes. And with those data resources, we're not just hoping to provide data that might not be as accessible to our community members. We're hoping to provide a platform that's a jumping off point to have the discussions that lead to policies, programs, initiatives, and change in our community that can help make a real world impact on people's lives.
So we're going to be looking at a variety of health data sets, and wherever we see inequities, we're going to bring people at the table and we're going to talk about those inequities. How do we get everybody together so we're not duplicating efforts, we're complementing efforts? And that's where we see our role at public health.